to go up.
Oh my God. Okay. I love talking into a microphone. Okay, so we're going to get started. This is Care Mapping, a how-to guide for the mitochondrial patient community. My name is Stacy Taylor, and I'm a UMDF ambassador and a parent of 2 kids with mitochondrial disease.
And I'm Nikki Huggan, and I'm a UMDF ambassador, and I also have two children with mitochondrial disease.
So does anybody know what care mapping is? Oh, good.
All right, you're teaching,
Yep.
you're doing the whole presentation. We're out.
You're our expert. I'm going to bring the microphone over to you for just a second, actually, because we have to speak into the mic for it to be recorded. But can you tell us what care mapping is from your perspective?
Care mapping is looking for the people around you, including doctors, like professional people and family people and everybody, and how everybody has a place and a part. Yeah.
Yeah. Okay, that was too close to that speaker. So this is just kind of a visual representation of a care map. So before we get started with you guys learning how to care map, what it is and how to do it, just for our objectives for today, we're going to learn the basics about care mapping. We're going to create a care map. So you guys are going to have the opportunity to create a care map of your own. And we're going to learn about what you can do with a care map. And the ground rules for today, this is being recorded. So I wouldn't say that everything that you share is confidential, but if you do share anything that you don't want to go on the recording, we can actually kind of delete out part of the recording because we're going to be doing some open dialogue soon. Anything else to add to that?
No, just feel free to ask questions, and there's every question is valid. So don't be afraid to say what you're feeling or thinking.
Absolutely. And if there's anything that you need that we can get for you that would make it easier for you to participate, just let us know. So these are just some cartoons that we pulled from the interwebs, just kind of illustrate everything that we're all doing all the time, whether you are an affected adult with mito or whether you're caring for somebody with mito. I don't know about those of you who are parent caregivers in the room, but I hear all the time, I don't know how you do what you do. And oh my gosh, you're like super mom. How do you do it all? But nobody ever says, hey, what can I do to help? They just say, how do you do it all? I could never do that. So what we're going to do with the care mapping is kind of figure out, like, how are we doing it all? The picture done? All right, so what is care mapping? Nikki?
So it's a visual way to show the people and services involved in caring for and supporting the person with mitochondrial disease, you and or your loved one. That's the definition, right? But it's so much more than that and can be used in so many places. And we're going to get into that in a few minutes.
Right. And the important thing is that where care mapping started, it really was a caregiver who sort of sat down. It was actually Christy Lind. Her son's name is Gavin. She sat down with a provider that Gavin was seeing and just sort of like jotted all this down on a piece of paper just to show all of the different services and systems that they were involved with and that they interact with. This actually started out of Boston Children's Hospital. A doctor named Rich Antonelli was her doctor, and he does a lot of stuff with like family support, family engagement. So after he saw this, he really kind of tried to push it out so more people could share in putting this down on paper, seeing all of these systems that you're interacting with, and being able to share this information. Which leads us to, what can I do with a care map?
Okay, I think the possibilities for a care map are pretty much infinite. I think this is just a small portion of what you can do. So you can use it on Day on the Hill. You can share it, right? You can share it with your providers. How many of you go to appointments and you've gotten like siloed, like Your neurologist only sees this part. Your GI doctor only sees this part, and they don't look at the whole picture. This is a way for them to see the whole picture. So a lot of times we're going to probably say this non-compliance word quite a bit, but so let's say I go to the GI doctor with my son, right? And they tell me they want me to have him stop eating fried foods. But then I go to nephrology and she's like, his potassium's low. He needs to eat French fries every day. Okay. So when I go back to GI, this has actually happened, by the way. When I go back to GI, they're like, you didn't listen. Well, I didn't listen because I have this other provider telling me the exact opposite of what you're saying. And I think there's so many examples in probably all of our lives where we're told like we didn't do something, or they give us the look like you didn't do what I said last appointment. But they don't know that you've seen 7 specialists since the last time you were in with them. So this one too, share with IEP teams. If you have a school age child, I think this is something that can really help them see what your life looks like. Even if you work, okay, there are so many possibilities to share this so that people understand maybe why you need off on certain days. How many people here see doctors that only work like on a Tuesday, right? So you're requesting a lot of Tuesdays off and they don't understand why. So we're also going to look for gaps. There's probably gaps in our care for our children, our own lives, whatever, but we don't even see them because we're only looking at it in pieces and not as a whole. And I think we're probably all overextended, right? Like we need to look for the spots where we've overextended ourselves and our children, because when we get up and we can see them on the screen, but when we can get up and kind of look at them more closely, you'll see like when Stacy has her 4 children over there, she also has one care map that's her and her husband that has all 4 children. Now, we didn't detail out the care maps, but for myself, like I have a lot of things too, right? I have my own doctor's appointments. I have my own friends. I have my own advocacy pieces. That's a whole nother care map, right? So, and help identify what decisions need made. I think when you really look at this, it seems like such a simple concept, but it's so incredibly important.
Yeah, just echoing everything that Nikki said. I think one of the things that I realized when I was doing my care map is how little we have in the legal and financial area. And my oldest son with Mito is 17. He just turned 17 in May, but now's the time we have to think about all of that stuff. He's going to be 18 in less than a year. So what do we need to do to figure that out? And when I went to do my own care map, that legal financial area is just virtually blank. So looking for those gaps, looking for where you're overextended. And yes, what do you have to do to take care of yourself if you're not the patient with Mito? If you are the caregiver, are you taking care of yourself? I would venture to say you're not. So where do I start with a care map? These are our families. That's Nikki and her husband. And this is Sam in the center. He's my youngest who is affected with Mito. And then Marshall in the orange there also has Mito. So they're here. And then there's our other 2 kids and my husband who should be here.
I'm thinking he better still give a 5-star review.
He better still give a 5-star review. Going to be sleeping on the couch. So you start with a patient in the center. So we're just going to show you a couple of examples of care maps. And then we are going to have you do your own care map. We have some supplies for you. And then we're just going to kind of talk about things while you're doing the care map. So this is one that a friend of mine did for her son, Eli. As you can see, Eli is there in the center. And one of the things that really struck me when I had looked at this one was for recreation and community, she had like gaming and listening to music. They're not really organized recreation activities. It doesn't have to be that like you're playing baseball for the high school team or you're playing soccer for the adult rec league. Whatever you're doing for your recreation and getting you out in the community is what you put there. And the other thing that's kind of interesting about this is that when you're doing a care map for somebody that you are taking care of, it's almost a little bit of a combination between your life and their life. So she's not doing gaming as part of her recreation unless she's playing a game with her son. But she is coordinating a lot of that stuff for her son. Sometimes she is playing games with him because that's what needs to be done to entertain him. But this is all stuff that she's coordinating for him to do. So him going to the community college, she still has to coordinate that, make sure he gets to and from, make sure he gets registered for classes, all of that. This is another example. It's a little bit busier. There's a lot going on. This is a young adult woman with very complex medical needs. You can see there's things like the durable medical equipment supplier on here, the wheelchair vendor, private duty nurses. There's a lot more stuff going on here. And we can kind of put these up on the screen at different times so you can look at them and get ideas. This is page 1 of mine, and this is mine and Nikki's are up on the wall also. So this just shows my husband and I, and then our 4 kids, Faye, Ben, Marshall, and Sam. Faye and Ben don't have mitochondrial disease, but they do have other challenges. So Ben is on the autism spectrum. He has ADHD. Faye is trans, and there are medical needs associated with that, as well as having ADHD. So there's a lot of supports needed for everybody. And as Nikki mentioned, you know what's not on there? My doctor's appointments. My full-time job, our pets, my husband's doctor's appointments. None of that is on there. So even while you're doing this stuff, think about that. Do you want to include your own personal stuff on there? This is for Faye. Hers is, Faye and Ben are like, they seem like they take up a lot of time, but they're actually pretty sparse. This is Marshall. He's got a lot going on. He has a lot of doctor's appointments, a lot of specialists that he sees, a lot of different facilities where we go. He's got a lot going on at school. The ones that are kind of in that outline in black are things that I'm like, oh yeah, I should put it on there, but I need to do something with that. That's not established. And then this is for Sam, which is very similar to Marshall's, but not exactly the same. They both have the same diagnosis, but slightly different needs. You know what's not really there? There's not a whole lot of support. UMDF is there for support. There's not a whole lot of family and friends. It can be really isolating to be in this situation. So there's not a whole lot of family and friends. I don't know if that's something we can work on, but it's something maybe we can talk about as a group today. The advocacy and information, there's a lot, but again, that legal, financial, that's more stuff that I have to do than that actually is already established. And we're going to show Nikki's.
So I want to talk about mine just so you understand. I had seen Stacy's already, so I purposely made mine very different because we wanted to show that it can be as little or as much as you want. It could be like the handwritten ones that you saw at the beginning, or it could be boxes and squares and circles, or it could be like you're like a crazy Pinterest mom, like mine. All right. These were done on Canva, so we're Stacy's. You can utilize whatever platform if you want to do them electronically, but just so you know, it looks a little different. So this is Jason and I, my husband and I in the middle with our 2 kids, Gavin and Hayden. And I actually started one that was ours and I got very overwhelmed, and I definitely have to go back to it, but it was kind of crazy looking at what I have to do and how it overlaps. So this is Gavin. He's my more complex of my 2 children. He goes to 3 different hospital systems, so I split them out. His education is like a full-time job all by itself. And then he has private duty nursing. He has 2 different insurances. He does do some extracurricular activities, but not many because of how complex he is. And support, just like Stacy said, there's not a whole lot of support. I know this isn't exactly what we're getting into, and we are going to talk more about it, but it is really hard. Like, I think I've met the most supportive people at places like this. Like the friends that I have who really understand what our life looks like and don't get upset when we can't be somewhere. So I think I probably should have put a little bit more of that in there too. So. All right, and this is Hayden. She's still a little complex, but not quite as bad. And I looked at hers, and I have to be honest, I'm kind of sad that she doesn't have more extracurricular activities. But then I realized that because of Gavin's additional needs, I'm not able to put her in as many extracurricular activities because I don't have a way to get her there, because I'm constantly worrying about whether or not Gavin can handle sitting somewhere or going in the car somewhere. So I think this was really a very, I want to say sobering experience for me on my life, because seeing it put on paper like this was like, wow.
Yeah, and I think that's a really important point to raise. Two things, like you said, it can be very sobering. So just as you're going through and doing your own care map, the care map for yourself, if you're the affected individual, or for your child, if you're a caregiver, your spouse, whomever it is you're caring for, it can be very sobering. And it can take a little while. So don't be afraid to get started on it today and then come back to it. In all likelihood, we don't really have enough time for you to finish up with it today. But also sometimes you just kind of have to think about things a little bit. And sometimes you just have to walk away from it a little bit, just to kind of give yourself that space and that grace.
And honestly, these took me days. I started on paper and worked my way into the computer. And even once I was on the computer, it still became overwhelming, because you think you have enough room for something. And then you're like, I don't have enough room for all of that over here. How does my child have this many doctors? So, I mean, if it takes you weeks to do it, it's okay. It's at your own pace.
Yeah, absolutely. So what is a care map again? Does anybody want to answer? What is a care map?
Somebody has to be brave. I'll bring you the mic.
I'm going to bring this over to you.
I think a map with the care of your child or family at the center.
Yep, that's pretty much it. So we have some tools for you that you're going to be able to use in creating your own care map. This is a template we have printed out on 11 by 17 paper. So we're going to hand those around if anybody wants to use that tool in particular. This is just sort of, we don't have this printed out, but this is just sort of a smaller zoomed in version of what we're going to hand out. So you have you or your child in the center, the person receiving care, and then you can kind of branch out from there. Other tools that you can use, Nikki mentioned Canva, which is what we both use. You can use PowerPoint, Google Slides, anything like that. A mind map template, which is available on a lot of those things, pen and paper. And then some advice. Nikki, you want to give us advice on these?
Okay, so this isn't like you're cheating. Look at your neighbor's map, all right? Look at their map and say, am I forgetting anything? Because I had to look back at Stacy's maps multiple times to make sure I wasn't forgetting anything. And don't try to copy someone else's map. Your life is different from theirs, okay? Like maybe you have the same amount of doctors, but maybe they're not all the same doctors. Maybe you have the same extracurricular activities. They're not quite in the same order, or there's so many differences in all of our lives. Just make it your own. And
I think it says don't overmap.
Yes, do not overmap. Like, sort of once you get into this, you'll realize what that means more. You're going to want to write everything in your whole world down, but then you realize like some things really are just an offshoot of something else. So you don't need to write every single piece.
So this is another handout that we have. This just shows some example categories and then some kind of subcategories that you might put under there. So going back to the template where you have you or your child in the center, and then you might have important family members and friends as one of those big categories branching off of the center. And you would put immediate family, extended family, friends like family, whatever feels comfortable to you. But this is another tool that we're going to give you, but you can use it to create your own care map. And you can see it has like the legal, financial, the support. This is not an exhaustive list, and it's also not an inclusive list. So you don't have to include absolutely everything that's on here. You only want to include the things that are really applicable to your life. But also, you're not limited to what's on here. You may have a category that really takes up a lot of your time and energy that is not on here and that maybe nobody else has thought of. And if you do, please share it with us.
You know, when you're looking at this, like Stacy said, she really realized how much more she needs to do in one category. And I would say as you're doing it, age is going to play a huge factor. If you're caring for a small child, some of this is not going to be as applicable as it would be for an adult. So just keep that in mind. Don't, if you're looking at your neighbors and they look like they're really have a lot going on in one category, it doesn't necessarily mean you have to.
Yep, good point. So now it's your turn. So we do have some tools that we can hand out. You have some colored pencils and some pens. You skip past the screen. We also have some handouts that are kind of a question and answer format if you want to do that before you actually get started. And then we have the slide that we just showed you that has those examples of categories. So we're going to come around and hand some out. We have the template, and then we also have some blank paper. And if you need anything else, just give a shout. So a couple of quick reminders as you all get started. One question that came up already is, wait, what are you going to do with this care map? What's the purpose of the care map? Did anybody think of anything while we were talking about, like, you know what I'm going to do with this thing? I'm going to bring the mic over to you.
I have to be standing looking at those. So I'm doing it for my wife. So as an adult, her extended family never seems to understand what she's going through. So I think this will be one tool to help explain to them all the stuff that impacts her.
That's a great use for it.
So in theory, I'm going to make two. I'm going to make one for myself for validation. My therapist always says that I do way more than what I realize. So I better be able to see it on this map. And if I don't, I'll just add more and more things to it, like details. That one, I'm going to start though first with my young adult daughter, because I think that that would be helpful, because she has so many balls in there, but we've never really laid out what those are. So I think it will be a great visual.
I love that. Yeah, if you've ever asked yourself, particularly if you're not the person affected with mito and you've ever asked yourself, man, why am I always so tired? Guess what? That's why. That's why. That's a huge mental and physical load to do all of that. So those are some things that you can do with a care map. I'm going to let you guys work for a little bit, and then we can talk about a few other things. Maybe things pop up for you while you're creating your care map. In the meantime, mine and Nikki's are on the wall over here. If you're able to, and you want to get up and take a look, you can. And then I'm just going to kind of put a couple different ones on screen for a few minutes at a time that you can look and use as an example if you would like to. So I'm going to interrupt you guys for just a second. You've been working for, I don't know, 15 minutes now. And a couple people individually have asked a few questions. One of the questions that somebody asked was about when you find those gaps, what do you do about it? Which that's a great question. And it really depends on what that gap is and what needed to fill it. Have any of you found any gaps where you're like, I think we really need to focus some attention in this area? And it doesn't have to be a really big area. It can be something like recreation. Like, we just need to get out and have fun a little bit more. Has anybody found any gaps like that?
one gap for my daughter is variety in daily activities. She doesn't like to do a lot of activities with me, but more with the mom. But that makes the balance skewed. So maybe I have to make more effort to get her out.
That's a really great point. Yep. Spend more time together. I find, because we have 2 kids who have mito. So we have 4 kids total. So we very much divide and conquer. So my husband tends to take care of our youngest. I tend to take care of our next oldest. But we need to switch that up sometimes.
Thank you. So this is for myself. When facing my own issues with helping my girlfriend. So far on the self-care section, I got through that really quick. I put a section for self-assurance. That's becoming difficult. Like I can make reflections, but I know I'm going to need to find methods that I don't always have to go to her and be like, am I doing okay? How is everything? Am I doing all right? I got to find more ways that I can get that assurance from myself. So that's going to be my next big step.
That's a good point. Does anybody else feel like that as a caregiver? Like you need that validation a little bit of like, am I doing everything that I can or should be doing? And I don't want to put words in your mouth. So please tell me if I'm misinterpreting what you said, but you don't want to go to the person that you're caring for to get that. Does anybody else feel that way sometimes? I'm going to call you out because you were nodding.
That's a really good point. I hadn't really thought about it. I mean, as long as I haven't fallen on my face, I guess I'm doing okay. And even if I do, then I just have to pick myself back up. I think meeting other people though, too, that you can call and bounce ideas off of is really important.
Yeah, I think that's one of the really great things about coming here and meeting other caregivers, other affected adults, and being able to have that kind of sounding board and get some information and tips from them. Any other gaps that anybody's noticed? Yep.
This isn't a gap really, but under support. I actually have a lot of support. Our family has a lot of support, but my husband always says nobody has any idea. And doing this is very helpful to put the fact that nobody has any idea about all of how much there is and how complicated each little thing is. So even with all the support, it's useful to have something like this to really realize no one has any idea.
I think that goes back to that graphic that we always see about caregivers with the iceberg, and we only see what's over the water and all that rest of that iceberg is under the water. I think we tend to hide the things in our lives that we don't necessarily think other people want to see. Like, I mean, in this room, I can say probably it'd be safe for me to talk about like yucky bodily functions and stuff. But if I was at a regular conference, probably not so much, right? So I think the things that we tolerate and the things that we understand about each other are totally different than people who don't live this life.
Right. You go out for lunch or dinner with a bunch of caregivers and you're talking about poop and vomit within the first 5 minutes. That literally happened. We went out for a dinner with the friend of a friend. So I'm good friends with another mom who is a caregiver, meeting her friend for the first time, who's a caregiver, not mitochondrial disease, but a caregiver. But she and I had never met before. Literally within 5 minutes, we're talking poop and vomit. That doesn't happen in normal relationships.
Seriously, how many times have you in this room been out and you say just like one thing that goes a little bit too far into something, like about a doctor visit or about your child being not really sick, but just not having a good day, and there's a poop or vomit story in there, and the people are giving you the wide eyes like, what did you just say? I mean, it happens.
And you're laughing. You're telling it like it's a funny anecdote, and they're like, oh my God, what is going on?
But this goes back to like the places where you can use these too. Like I can honestly say that luckily, my son has paved the way for my daughter because she has cyclic vomiting. And I don't like school, they don't like that. So I worked through with him, and now they kind of understand a little bit more that, yeah, she's going to be a little bit different. So they don't try to send her home every time she throws up anymore. Yeah, for 24 hours.
Right. What about when you think about those supports that you have, and if you think about maybe the supports that were in your life before your loved one was diagnosed, how has that changed? How have those relationships changed? I had a lot of friends that are really no longer a part of my life anymore because I don't know. I mean, they couldn't handle the intensity of what our needs were. And the fact that we were disappearing for a few months at a time because we were dealing with some crisis. Have those relationships changed for you since your loved one has been diagnosed?
I'm going to say yes.
Right.
Well, I'm thinking that even in normal adulthood, we go through that, right? Like when you have friends, and then when you get married, then you have married friends. And then when you have your first kid, then you don't quite relate to everybody. So all of a sudden you come around people who have kids. And so then, but there's not as many people out there who have like sick kids or are caregivers of even your parents or something. But so you really have to look a little bit harder.
Yeah.
Yeah, it is kind of interesting. I feel like I'm sitting down. This is a very casual conversation presentation. I feel like I have more in common now with my friends who are serving as caregivers for their elderly parents. So it's almost like some of those relationships changed, and we didn't talk as much, but now they're shifting back because they can understand my perspective a little bit better, but they're caring for parents. What about any areas where you're like, I got this covered. I'm good. I'm doing everything I need to do here. Does anybody feel that way about any of these areas? Yeah? Okay.
Say something good about myself. Two things. Just first off, physical aid. Like I'm a very active person. I work out like 9 days a week, and I'm a horseback rider and I do martial arts. So like I'm pretty physically fit, and I know some days that is more than enough to get my girlfriend through stuff. Like, can you please pick this up for me? Please do this for me. So now I have even more motivation, like as I age, to stay in shape, because I know that physically doing things for her is something that she can't do some days. So I don't even have to think about that. I just lift things up and put them down, and it's good. So the other thing too, I know, is because I believe strongly in education, I will keep learning and I will keep evolving and I will keep getting information that she will need. And I know I'll be better as I go. So those are my strengths.
Hearing you say that, I have like the opposite thoughts. Like, I don't work enough and I'm concerned. I mean, I think this is probably a valid concern for many people. Like, what if my 12-year-old can't move and I have to lift 110 pounds? I can't do that anymore. I really need to now you have a gap for me.
Yeah. We're addressing that right now, as our youngest is too heavy for me to lift. You should have seen me trying to get him up on the bed last night. It was a little comical, except that it also hurt. But yeah, I mean, this is a weird thing. Whenever I see like action movies, I always think like, what if it were the apocalypse and I had to get Marshall and Sam out of town? I can't do it, right? Like I can't do it. And then I'm like, man, I got to start working out. That does not fit onto my care map. I don't know if y'all have seen that, but that does not fit onto my care map anywhere. But that is something that is important, that you staying physically healthy is really important in order to be able to care for your loved one. That is something we all have to think about.
I do want to say that Stacy is not alone in this thought on the, crazy random things happening and then thinking how I'm going to get my children somewhere. When we were inpatient at CHOP was the earthquake that happened. And all I kept thinking was, if there's a bigger earthquake after this, how do I get him out of here? Like, what do I do?
Yeah. Yeah. I know, I have two older kids also. I share it, and I call on them frequently to help me, and they're probably not going to live with us forever. That's the other thing. That's like a gap that we have, thinking about that transition. Marshall, you saw him, he was the brunette. He's 17, Sam is 15. Thinking about that transition when they finish up school, guardianship, Social Security, all of that stuff. What do we need to do to figure all of that out? That's all those big black outlines on mine. I got to figure that stuff out, and I got to figure it out soon.
And I know it varies so much state by state with everything that you need to do, but it is super overwhelming. Like, I feel overwhelmed just saying it out loud. And there's little nuances, like in Pennsylvania, if you get the ID card before they turn 18, then you're good. If you wait until after they're 18, it's a big process to get one. So it's just crazy that you need to really network and find your people to help you find all those pieces. Oh, yeah. Yeah. So my husband's bringing up that we see one doctor at the University of Toledo, and that state has like an age of consent for medical records is 12. Well, the day that she turned 12, I lost all access. And I didn't know why, because in Pennsylvania it's 13. So I thought I still had a year, and it turns out I don't. And now, unfortunately, because he has a developmental disability and an ID diagnosis, I said, how do I get these? And they said, well, he can't sign. And of course, they've never run into this before. So now I'm in this big circle of trying to find a way to get access to his My Chart.
We had a similar situation with one of the facilities near us, even though Maryland law is older. I'm going to advance the slides a little bit. We had a couple of things that we wanted to talk about at the end. And I know as some people are either deciding that they're going to work on this independently or are kind of finishing up. We'll just go through a little bit at the end. And if you want to take any extra copies of anything to share for your loved one, for other family members to fill out, please feel free to do so. So what's next? After you do your care map, after you fill this out and finish it, who are you going to share it with? Some people have already come up with some suggestions beyond what we talked about. Somebody said they wanted to share it with immediate family because they don't get it. They don't, they try to help, but they don't totally get it. I think I would like to share mine with providers. I feel like, because each provider focuses on sort of a separate part of the body, that is their priority, which makes sense. They went to school for a long time to study that part of the body. That is their priority. But do they ask us if it's a priority? Do they ask us if what they're telling us to do is our priority and if we have time to do it?
I use maps like this in different areas of my life. So I'm thinking of one that you have the person, but then all their different specialists and what meds that specialist currently orders, and what testing that doctor wants, and what diagnosis that doctor gave to the person. And then that's something then to show the doctors, because they like to know that she works, but they talk about that anyways or something, but it's not that important. The other thing that I've found helpful is making a map of formal and informal supports. That's what I was trying to say at the very beginning, and I couldn't get the words. So, whether it's your church, whether it's your neighbors, whether it's your family, just to list those out Because when you come to time that you need something, you can't think of anybody. You can't think of anything. And if you have that to go to, then it's there.
Thank you. Yeah. Somebody else was talking about, and I think this often happens in families and relationships like ours where there's a primary caregiver. So particularly when you're talking about kids, you know, you might still have your spouse or significant other, but one of you is the primary caregiver while one of you is the breadwinner. So even sharing this with your spouse, so they know all of the components of care that are required, because what if you're not available at some point? And not that something catastrophic has happened, but just you're not available. And they can kind of have this like little map outline of like, okay, these are all the providers that we see, as you know, the DME equipment, all of that stuff. Another thing that Nikki had talked about was creating a timeline of what symptoms started when. And I think that's a really important thing to note, because sometimes what symptoms started in conjunction with other symptoms can really tell the provider something. And we can't remember all of that. You know, so having that timeline is also really nice. Yes, Jason just had a really great point repeating doing the care map. This isn't a static document. These are living documents. I mean, we just added another provider last week. We got a referral to rheumatology. I don't know, that's not on our care map. So really kind of taking a look at this and revising it either on like an annual or every 2 years or every 5 schedule or as needed, I think is a really good point too. And then just kind of creating and printing that one-pager document, the information about your loved one, so you can share it. Anything else on these, Nikki?
So I have a couple of vision board examples. None of them are medically complex, but at the end, if you want to come up, I can give you a few. I personally, the front of mine, and I don't have mine, I apologize, is just their likes, dislikes, how to connect with them. But then the back is all about Mito. It's their symptoms, their doctors, how things work for them. If there's an issue with the bathroom or an issue with food or anything, that's all in the back of it then. So just so you know kind of how I set mine up, doesn't mean you have to do it that way, just an option.
Yeah, I did something similar during an advocacy class. We did just basically creating a vision for your child, but it starts with that vision statement. And it can be for your child or your loved one that you're providing care for, but you start with that vision statement, like, what do I want for them? Do I want them, you know, to be able to live independently? Do I want them to be able to work outside of the home? Do I want them to be able to have a pet? What is it that I want for them that's realistic, but also still aspirational? And then when you are trying to make some of those tough decisions about like getting a surgery or enrolling in a certain program in school, you can kind of go back to that vision statement and say like, well, does this really support the vision that I had?
And you can have one vision and your person you're caregiving for can also have their own vision. You can incorporate that how you want to, because, for me, my 9-year-old thinks she's going to be a princess. I don't think she needs her own vision statement or she's going to be like in Europe looking for monarchy to marry, right? But, but, at some point she wants to be a teacher and a doctor. Will that stay? Will she still want to do that? If so, I'll add that to her vision statement and her vision board. For my son, he still wants to be a superhero and he's 12. So will he ever truly be giving me something? And that's why I'm saying you might need to mix the two. I don't know that he'll ever intellectually give me something that is a real he's going to make it to. Because as much as he wants to be Super G, I'm not really sure that he's ever going to gain those superpowers unless one of these scientists comes up with some super serum.
I mean, he could get bit by something radioactive or something at some point. Yeah, I think that's it. So feel free, I think this session is scheduled until 3:30. Stay, work on your care map, take some extras with you you, anything that's sort of bubbling up to the surface that you want to talk about while we still have some people here, we can absolutely do that.